Okay, I'm going to show you my ID and then scan my room. Okay. So the first thing I would do is plan the medication administration to avoid interruptions. Excuse me. To avoid interruptions, I would keep the door to the medication room closed. I would not take any phone calls, and I would limit conversation with colleagues to only essential information and follow the agency no interruptions on policy. The next thing I would do is I'm going to compare the medication order on the patient's chart to the medication administration record. The patient's chart says heparin 5,000 units subcutaneously every 12 hours, and the MAR says heparin 5,000 units subcutaneously every 12 hours. The next thing I'm going to do is locate and verify the 5 rights of medication administration. First being the right patient, Jaguar Jones, the right medication, heparin, the right dose, 5,000 units, the right route, subcutaneously, and the right time, every 12 hours. The next thing I'm going to do is compare the patient's allergies on the patient chart to the MAR of allergies penicillin. Then I will perform hand hygiene and then select the correct medication and compare it to the MAR. The MAR says heparin 5,000 units. I have heparin 10,000 units per milliliter, so I'm going to have to calculate the correct dosage. I'm also going to ensure that the medication is not expired. This medication expires 12/5/2025, so it is not expired. So I'm going to break sterility and I'm going to move these out of the way. Okay, so the next thing I would do is verify that it is the correct time for administration of the medication. It is 12 p.m. Mr. Jones is to be administered heparin every 12 hours, and he has not had a dose in the past 12 hours. In selecting the correct equipment for the subcutaneous injection, I'm going to be using a 1 milliliter tuberculin syringe with a 25 gauge 5/8 inch needle. The next thing I would do is calculate the correct dosage to administer to the patient. Mr. Jones is to be receiving heparin 5,000 units. This bottle is heparin 10,000 units per milliliter, so I have calculated that Mr. Jones will be receiving 0.5 milliliters or half of a milliliter of heparin. I would check my calculations twice to ensure that they are correct. So now I'm going to break sterility and I'm going to move my orange out of the way. The next thing I would do is cleanse the vial. And I would open my syringe. Now I'm going to scoop, and then I'm going to compare the syringe to the MAR. I have heparin 5,000 units, which is 0.5 milliliters. And if indicated, I will verify my calculations with another nurse. The next thing I'm going to do is do my second check for accuracy and compare my prepared medication to the MAR. This medication is for Jaguar Jones. I have heparin 5,000 units, which is 0.5 milliliters, subcutaneously every 12 hours. I've also prepared a piece of tape with the patient's name, Jaguar Jones, the medication, which is heparin, the dose, 5,000 units, and the amount that I'm going to administer, which is 0.5 milliliters. I'm going to take that to the syringe. And then I would proceed to the patient's room with the medication and the MAR. I would perform hand hygiene, and then I would verify patient identification using the patient's armband and the MAR. I have Jaguar Jones, date of birth 8/25/63, 8/25/63, medical record number 417-417-6352-6352. So the next thing I'm going to do is I would speak to Mr. Jones and I would say, Mr. Jones, I see you have a penicillin allergy. What kind of reaction do you have? Okay, well this is not penicillin, so you should be okay. And for certain medications, I would perform pre-administration assessments such as blood pressure or pulse. The next thing I'm going to do is perform my third check for accuracy and compare my medication to the MAR. This medication is for Jaguar Jones. It is heparin, 5,000 units, which is 0.5 milliliters, subcutaneously every 12 hours. The next thing I would do is explain the procedure to Mr. Jones. I would say, Mr. Jones, I'm going to fill up your abdomen to see where I'm going to give you the medication, and then I'm going to give you the medication, and I'm going to tell you before I do it, it's going to be just a little stick. So the next thing I would do is raise the bed to a working height and lower the side rail. Now I'm going to put on my gloves and my goggles. Okay, so I'm going to break sterility. I'm going to move this out of the way. I'm going to move my orange, which is my patient, so you can see it. I'm going to move this out of the way too. And move my sharps container. Okay, so then I would assess the injection site, and I would choose the correct injection site based on appropriate landmarks, and I would expose the injection site only. For this medication, I would administer in the abdomen 2 inches to the left or the right of the umbilicus. I would also assess the area for any bruising. Now I'm going to swab the injection site. And now use the alcohol swab. I would pinch the skin. And hold the pinch. And then the next thing I would do is lower the bed and raise the side rail. Now I'm going to take off my gloves. And my goggles. And I will perform hand hygiene. The next thing I would do is observe the patient to see if he has an allergic reaction, and then I would document on the MAR, and if indicated for certain medications, I would document the patient's response, and that's for like pain medications. And then the next thing I would do is that is also the 6th right, which is the right documentation. And then the next thing I would do is I would come back later and reassess the patient's response to the medication if indicated.